Good afternoon. I'm Libby Znaimer, Vice President of News here at Zoomer Media. Welcome to CARP's Forum on the 2013 Liberal Leadership Race. These forums provide CARP members with the opportunity to hear directly from those asking for their votes, and they give politicians the chance to reach out to more than 300,000 politically engaged CARP members across the country. At this point, 7 candidates remain in the race. Today, we welcome 5 of them: Martin Cauchon, Deborah Coyne, Martha Hall-Findlay, Karen McCrimmon, and Joyce Murray. We're anxious to hear their positions on the priority concerns of CARP members, which are retirement security, seniors' poverty, and equitable access to health care, affordable drugs, and home care. CARP members believe that no matter who wins, in order to be successful, the Liberal Party, any party for that matter, will have to address the needs of Canadians as we age. Our debate moderator is CARP's Vice President of Advocacy, Susan Eng. Susan?
Thank you very much, Libby. Welcome, and thank you very much for joining us today. As Libby has said, we do have 300,000 members across the country, and like most older Canadians, CARP members are politically engaged and very well informed. And, by the way, they always vote. And just this morning, we heard that 60% of those who are registered to vote in this Liberal leadership contest are over 50 years old, and only 8% are under 25, the target of the Twitterverse. I'm just saying. So we make a point of making sure that our members hear directly from those who want their vote. And we have held 3 election debates so far at all levels of government, and cabinet ministers have attended our annual general meetings, and last year it was the leader of the official opposition. Today we have the chance to hear from people who very well sit on the front bench of their party in the House of Commons. As before, the CARP Leadership Forum will be broadcast on Vision TV, and it is being live cast on our website. So let's begin. Now, I invite the candidates to briefly describe themselves, introduce themselves, tell us why they are running, and why they felt it was really important to be here today to talk to CARP members. Now, lots were drawn for the speaking order, so we will start with Deborah Coyne.
Oh, thank you very much. Well, I'd like to thank CARP for organizing this debate and giving my fellow candidates and me an opportunity to discuss issues that are facing older Canadians. But these aren't issues that are restricted to any, one given age group, because these issues, whether it's health care, elder care, pensions, retirement security, aging with dignity and respect, affect everyone. What they require is bold national leadership, something that is very much absent with the current Conservative government. I'm in this race because I believe the Liberal Party has to get back to being the party of bold national leadership. It doesn't mean micromanaging or imposing blueprints. What it means is rallying Canadians behind a vision and principles that bring citizens and governments to the table to work together in the national interest. So I am hopeful that Canadians will respond to my call for bold national leadership, and together we can face any challenge and build one Canada for all Canadians.
Thank you very much. Joyce Murray.
Well, thank you very much, and great to be here. My name's Joyce Murray. I'm in this race to offer my vision of a truly sustainable society. And I come to that from having been an immigrant. I'm a mother of 3. I built a business with my husband Dirk, and we've planted 1 billion trees across Canada and abroad by now. And I've spent time thinking about these issues as a cabinet minister in British Columbia, including Minister of Environment, but also Management Services. So I'm really pleased to be here because the quality of life of people, of Canadians as we age, especially as we need support, is everybody's concern. And so I welcome the questions and the chance to discuss that. Thank you.
Wonderful. Thank you very much. Next, Martin Cauchon.
First of all, thank you very much for inviting and as well for hosting this debate. I'm here today basically because as I used to say, I'm a product of Canada. I was born in Eastern Quebec, very humble background. My father used to tell me that I was a lucky guy being born in Canada because everything was possible. Became cabinet minister, member of parliament, justice minister at 39. And today, when I look at our society, the society of hope that I used to know, equal opportunity, I believe it is just not there. When I look at my 3 kids as well, I'm not sure actually that they have exactly the same future. And I'm coming back in order to make sure that we're going to keep building the Canada I believe in, the Canada that we used to have. And I want to make sure as well that in building that Canada, we're going to pay attention to our Canadians. And when we look at the demographic today is changing. Canada, we used to have the heart at the right place, taking care of our people. So we need to pay attention to our seniors as well in changing our social safety net. And the marketplace is not what it used to be in terms of the job creation. We really have to adjust ourselves on that side. So this is the reason why I'm here. And I'm looking forward to the debate and as well to hear what you have to say.
Thank you very much. Martha Hall-Findlay.
Well, it's great to be here, Susan, and it's great to see you again. And I will echo the thanks to CARP for hosting this. It is an opportunity, another one for us to engage in debate. And that's something, quite honestly, that I think a number of us have felt very strongly about, that the future of the Liberal Party does require leadership with vision. But vision has to be based on principles and values, but it also has to have clear ideas on how to achieve that vision and what lies beneath those principles and values, and clear ideas. You know, and in my particular case, certainly having been a business person, I, like Joyce, 3 kids, lived through teenagehood, survived, lived to tell the tale. But being a mother, being a business person, and certainly politically too, I learned a great deal in 4 different shadow cabinet roles: transport, infrastructure and communities, associate finance, public works and government services, and international trade. All have added to a tremendous level of experience for me to be able to have a better understanding of what we can and should be doing politically as well. I mean, you can talk, but you really need to be able to know what to do. And in this particular case, the fact that we have what is, in my view, a ticking time bomb with our aging demographic. You, of course, know this. Everybody in this room knows this, and everybody watching it. But our job as politicians is to come up with some solutions, real solutions to some of the clear challenges that we'll be able to discuss here today.
Thank you. And Karen McCrimmon.
Susan, thank you very much for the invitation today, and I'm really pleased to be here. Most of you know I'm a 31-year Canadian Forces veteran. I retired at the rank of Lieutenant Colonel. I've led international missions abroad, and every time I go abroad, I come home and I just know just how fortunate I am to live in this wonderful country. And people say, well, why are you doing what you're doing? I'm doing what I'm doing because I need to ask Canadians to step up, to speak up, to stand up for their country. And if I wasn't willing to do it myself, how could I possibly expect that of someone else? And when I signed on the line to serve and protect my country, that did not end just because I took off my uniform. This is a generation who has a huge leadership role to play in the future of this country. You can lead the way. It's about developing community. It's about working together instead of having a government that wants to divide us, young from old, newcomers from people who are well established. We need to head off in the same direction together, and we can provide the leadership to do that.
Thank you very much. Thank you, all of you, for being here. Now, CARP has 56 chapters across the country, and a lot of the chapter chairs have questions for you. 4 of them will be on screen. So let's start in Sudbury with Pat Douglas.
Hi, I'm Pat Douglas. I'm the CARP chair for Sudbury, Ontario. How will you and your government work with all the provinces to ensure that health care across Canada is equally accessible, of high quality, and sufficiently funded? Would you propose income testing for drug coverage or home care? And how would you solve the systemic problems with the healthcare system? Thank you.
Deborah, you start off.
Okay. Well, this healthcare is a perfect example of what I see as a lack of national leadership. And first of all, Mr. Harper has just stepped back and said, I don't have anything more to do about it. And he's wrong. Federal government is responsible for national healthcare standards and making sure that we have comparable access to quality and the range of services across the country. That's fundamental. But I'm very practical in my program going forward. We have to do something to modernize our federation to ensure that everyone knows there have to be forums with Ottawa at the table. So as you know, right now, Mr. Harper sort of spun it off to this group of provincial premiers. I don't have anything against them, but they're just not wired nationally. So they sit around and they figure out a few drugs that they can bind together, or they sit around and exchange practices, and then Madame Ravois walks right out on it. Now that is not what we need. We need everyone working together, and you need Ottawa at the table. So my proposal is to use the Health Council of Canada to beef it up, give it a different role. I've also put forward more generally something called the Council of Canadian Governments, which is an administrative body, because essentially not just healthcare, pensions, everything involve all levels of government, and you simply have to get everyone at the table. And the final thing I would say is that as a party who wants to form government, you go into the next election not with a whole bunch of confusing accounting-like proposals, but say, here are our priorities. So in 2-3 years, we get national healthcare standards and a mechanism in place. We do something about pensions, expand CPP, and so forth. And I'll pass it to the ones.
Now, I open it up to the rest.
Well,
Joyce.
Since my vision is about a sustainable society, and that means that our children would have access to the kind of healthcare services that we enjoy. However, that's a challenge when with the changing demographic, and there's challenges with healthcare delivery today. So this has to be a huge priority for the federal government. I mean, I do want to say that sitting in cabinet for 4 years, we spent more time on the challenges of the healthcare system and the cost pressures of the healthcare system than anything else. What we don't have is some clear measures, and so if we were to add a principle to the 5 principles of the Canada Health Act, I think it should be accountability and measurability, so we can really, what you can measure, you can improve, and then there's a lot of ways to go about doing that.
Martha.
It's interesting, in 2004, in the election, by far, the best issue at the door and in all of the, every time you were talking to somebody, it was home care. It was, we need home care. And all of us who have had to deal with aging parents, and that's pretty much everybody in the country. That's why it resonated so much. It was such an important issue. And then, of course, we ended up with a minority government. We weren't able to move it forward. And now I couldn't agree more with Deborah. There's been a complete abdication of any responsibility at the federal level. I mean, I don't know about you, but it's called the Canada Health Act. I mean, the Canadian federal government should actually be participating in this. And
what we're not doing is prevention. I mean, that is really
a huge
part of the federal government's role. And it's like instead of putting a fence at the top of the cliff, we're wondering why we don't have enough ambulances at the bottom of the cliff. I mean, we need to be preventing. And there's a lot of levers
the federal off any cliffs.
Yeah. I mean, right now in Canada, there's 7,500 senior citizens living in hospital because there is no long-term care bed for them.
They're called bed blockers.
Well, no, I don't like that name.
Well,
I don't like that name.
But
I just don't. They have no other option.
Such a big issue because they don't, and that's a huge
And this
problem.
is what the federal government could play a role in this and actually work directly with the communities through the provinces and find out where those problems are. I live in a small community, and I know that when the time comes I'm going to need care, I'm going to have to leave. Unless the community comes together and creates another options. Communities can do that.
Well, and
Martin, you want to get in here?
I'm going to do my best. Being the only man is going to be tough here.
We should have put him right in the middle.
It's a key discussion, actually. When I was cabinet minister, we used to look at the top topics for the country, and every time it's healthcare and the economy, of course. I come from different angles. I believe healthcare is delivered by the provinces, so on the front line it's really the provinces. But Canadian government, though, as you said, Deborah, has to play a leadership role, actually. We have the 5 conditions of the Canada Healthcare Act, and we have to make sure that that will be respected. But one of the leadership role that we should have, 2 points basically. First point is to bring the provinces together to make sure that they're going to share best practices. When you look at the delivery, I mean, in the province of Quebec and Ontario and BC, it's different and it goes in all the directions, but those provinces are doing a wonderful job, and it would benefit the system if we could bring them together through our leadership. The second point, when we don't talk about that, and it's a pity, our public healthcare system today is getting poorer and poorer every day, as a result of the fact that there's a private healthcare system that's developing. We don't want to say it, we don't want to talk about it, but every day that private healthcare system grabs resources out of the public system. We need to stand up and make sure that we will protect what I call the universal healthcare system. It is key, actually.
I do want to interrupt for a moment because I disagree with something you said, Martin. There is a serious role in delivery for the federal government, and that is for our veterans. It's for Aboriginal communities.
For the Aboriginal people, what we're responsible
for. The armed forces, and we're doing a terrible job on that. Think about the struggle the veterans are having.
We have just funding generally.
I was going to say the questioner asked some pretty specific questions about pharmacare, for example, and I think several of us.
Let's talk about the systemic problems and the funding, especially at the federal level here.
Roy Romano did a big report, which basically said we need to put more money, and then Senators Kirby and Cauchon did another report, which quite honestly I thought was really good because it went into a significantly greater detail about how we can render the system more efficient, because quite honestly I don't believe we can just keep putting more money at it. Every dollar we put into healthcare is dollar that is not available necessarily for education and other aspects of our society. So we absolutely have to be more efficient, and I would recommend anybody interested to look at the Kirby-Cauchon report because it really went into a lot of detail.
And we have. Now we're going to hold you there because we will be covering healthcare some more in the next couple of questions. We're going to go to the West Coast now. Ramona.
Hi, I'm Ramona Captain, chair of the White Rock Surrey chapter of CARP in British Columbia. How will you and your government ensure that Canadians have equal and adequate access to home care and other chronic care in the community? And how will you support family caregivers? Here in my community, there are many boomers who have elderly parents, and they definitely need help.
Joyce, you lead off this one.
Well, Susan, and to the questioner, Ramona, the Liberal Party actually had a great platform on supporting home care, and I think it's been completely watered down by the Conservative government, a $300 non-refundable tax credit. And so to me that symbolizes exactly what this government has done in increasing income inequality, because they have this set of boutique tax credits like for home care or for sports or for arts or for firefighters, but they're all non-refundable. So that means that people who are the lowest income don't get any of those dollars from the Treasury, and it actually increases income inequality. So we need to make these refundable, and it needs to be a much larger package, like the package we had in the last election, $1 billion a year to support people. That's actually part of prevention, because if you support people in staying in their homes, and my mom, who's in her mid-80s, lives in her apartment in Vancouver and is managing well. But people need support. That's part of preventing problems, preventing falls, and hospital stays.
Now, we had a chance to read the Liberal program for caregiver support, and we tested it with our members, and they were very supportive of its comprehensiveness and the attention to the kinds of issues that confront families all the time. I'm going to give Martin the first chance this time.
A bit like Joyce mentioned, I mean, we're not going to debate there. We're both on the same side in the sense that a refundable tax credit is indeed needed. But as well, leadership. You were talking earlier about the question of funding. Paul Martin signed the last healthcare agreement for a generation. It will come for renewal pretty soon, as I said. But what I believe is that now the delivery, when we look at the delivery, it's really the provinces, but the system, the demography is changing, society is changing. Home care is needed. So I believe the Canadian government should make sure in renewing the agreement that some money will be carved out for special program like home care delivery. I mean, remember what Jean Chrétien signed an agreement about 15 years ago. He was told actually that there was need for more technologies in the healthcare system. What he did, he signed the agreement and he carved out a special agreement for healthcare for the technology, making sure that the provinces would be using that part of the money indeed for technology.
I think the discussion of home care highlights the need to focus on the human side of government or the human side of public services. Because, yeah, technology is fine, and that was a good approach to make sure that you have access to the highest technology.
Yes,
But
it's an example of leadership.
Yeah, but it's the front lines and it's the support workers and all of that. I mean, I guess Karen and I were just talking. It's like the schools. They have soft underbelly. The first thing that goes in the cutbacks are the teachers' assistants, which are so necessary, and they are a good investment. They provide jobs. You know, it's not technology, but it's helping. It's much more durable. Same thing on home care. So I think it means prioritizing, and I believe the Liberal Party has had a good position here and saying that this is as important as anything else, and in fact it has economic benefits and employment benefits.
Absolutely, Karen.
And right now, I mean, the provinces, their budgets are stretched already to no end. And this is where the federal government can step out with something like a community innovation fund. So if we have 7,500 seniors living in a hospital and the province says, or the community says, we can build a long-term care facility, let us do it. And then the federal government give them a loan, a 20-year loan to go ahead and let that community build a long-term care home. And then the province will end up saving money, and then there'll be more money for other things. So that we have to think a little differently.
Martha.
Ramona asked, one part was actually very important, and that was what to do with family caregivers. You know, and you know, Joyce is lucky her mom is living alone and doing well. Mine passed away a couple of years ago, but in the last couple of years, my sister, thank God for my sister, who actually lived close. It was a small town, lived in the small town close by. There's 3 sisters, 3 brothers, but you know, I could make a joke about the boys, but anyway. But seriously, and Ramona is absolutely right. It was one sister, because she was close by, who absolutely had the burden of helping our mom out. And we're incredibly grateful. But she was a teacher. She still is a teacher. And it was very difficult. We absolutely need, and a little bit of tax credit here, whether it's even refundable or not, just doesn't address the real challenge. And so I thank Ramona for the question. It's obviously something that we have to address much more fully.
I'd like to add that I think what we all want to do is be as healthy as possible as long as possible.
Yes.
And so there are preventable chronic diseases that are pretty rampant in our society, and there has been very little leadership on the part of the federal government. So for example, when I was on the health committee, we studied both the levels of sodium and salt in foods as well as trans fats. The Conservative government got all of the reports on what the impacts are from a cost perspective, $2 billion in heart and stroke problems from salt, really high sodium levels, even compared with the same processed foods in the United States. Sure. And the recommendation was to regulate, but they've decided not to.
But you know, what about funding? What about funding?
Well, just to do the systemic problem is that we can't seem to have governments that think long term. Because as a Canadian, I see these reports and I'm saying, why aren't we doing something? Same thing with chemicals, dangerous chemicals. Like we seem to take years to determine, oh yes, they are dangerous, and then we're taking them out. Now on to funding. Are you talking the private? I wanted to respond back to Martin.
You have lots of time.
Yes, on the funding. Just I understand your concern, and I certainly do not support two-tier health care or anything allowing doctors and nurses to go into both systems. But you have to be careful when you just say it's taking too big a role or whatever, because I think that's where it sends the debate off into la-la land, because then we start saying, oh no, we can't have anything, and yet most of us have our blood taken at no, I'm not going to exactly. But all I'm saying is that we need to have more oversight of those. I mean, I've been hearing horror stories
we need to have
about
a national. We really need to have a national discussion on that. What I said is that because we don't want to look at the problem. I mean, the public system is getting poorer every day because the private system is grabbing all the resources. I mean, and because we don't have any rules.
Well, let's talk about money. Let's talk about money. We're going to the next question. You have a chance to cover this point again. We're going to stay on the West Coast. April Lewis.
Hi, I'm April Lewis, BC representative for CARP. The United Way recently released its report saying that 3 out of 5 Canadians over the age of 65 live on less than $25,000. How will you and your government deal with Canada's deficit while protecting the most vulnerable in society? What will you do to ensure that no senior lives in poverty?
Martin, you lead off on this one.
Of course, we in Canada, and when you look at all the OECD members, and you look at Canada, and you look at the economy we have, we're doing okay with our senior, but we could do much better. I just don't have the exact rank of Canada among the OECD members, but there's really nothing to be proud of. There's a system that's in place actually, which is the old age security system that's in place. We know what happened with the Harper government. They postponed the access to benefit to the age of 67. The guaranteed income supplement as well doesn't help people at all. So what I would be doing as Prime Minister of Canada is to make sure to increase the guaranteed income supplement so people are above what I call the poverty line. There's CPP in place, Canada Pension Plan. What I believe is that we should improve the Canada Pension Plan, make it more flexible also. There's a lot of people that will be outside the workforce for a period of time, and during that time they just cannot contribute to the CPP. I believe with a more flexible CPP, a lot of people could have access and make sure that they're going to have access to good benefit when needed.
Absolutely.
I'd like to follow up on the CPP conversation. It was a Liberal government in 1998 that actually fixed CPP for the long term.
Paul Martin did it.
Yeah.
I remember very well. I was around the table.
And, you know, at the same time, there were Reform members, some of whom are in the Conservative government today, that were calling for the elimination of the CPP. What they wanted is that everybody is depending on their own private insurance.
I was in the House.
But let me just tell you one thing that would have been disastrous is that CPP is also a pension for those that are disabled. It's a disability pension. So imagine leaving it in the hands of people who are disabled to create a private pension plan for themselves. And congratulations for having been in the House at that time.
We were, if I may, because I was there. We were among the first country in the world to make sure that our pension system would be sustainable. And I remember when we moved with that, you're right, your position were just on our back saying that we shouldn't do that and basically get rid of the pension system.
Having history, we're going for the future.
I mean, the history's great, and we're incredibly proud of the fact that the Liberal Party has been the party of bold ideas and brought in CPP and OAS. But April's question is really good. You know, there are far too many elderly people in this country living in poverty, especially older single women, and it's appalling, the conditions. We can rank ourselves in terms of the OECD, but it's still a real problem. My view is that, I mean, even with the CPP, I mean, my mother raised 6 kids, but she didn't get paid work, right? So she wasn't eligible to CPP. So what I've been suggesting is that, and I think CARP has talked about a universal pension plan, the CPP runs really well, right? But my view is that every Canadian should have a CPP account. We absolutely should be considering voluntary contributions. I'd even suggest taking a portion of every person's taxes that they pay and actually allocate those into a CPP, what would be everybody's individual CPP account. But fundamentally, you know, when Harper moved the OAS age of eligibility from 65 to 67, it was a hue and cry. And quite honestly, the Liberal Party said, well, all we'll do is we'll move it back to 65. That actually doesn't answer the problem. You know, what we fundamentally need is a guaranteed annual income for all of the people who otherwise cannot look after themselves. And let's be honest, there are people in this country who can't. Those who can should be contributing to their own. Those who can't will need our help. But 65 is an arbitrary number. 67 is an arbitrary number. We need a guaranteed income for people who otherwise would be living in poverty in this country. This country is far too affluent for anything else.
Joyce.
So with the OAS change, as we know, it was going to be hitting the lowest income the hardest. It was going to be taking up to $30,000 away from people that were really in need. And what that does is increase income inequality. And what we need to do is decrease it, because it's the lower the gap, the better it is for everyone at all parts of the spectrum. So what I've been proposing is that we have a system in government. What I would do is make sure that any policy brought in or any legislation brought in has an analysis in terms of the potential impact on income inequality. Because the way that we're going to reduce that gap is that we make sure that we don't increase it the way that our government has been doing, and that we're aware of the impacts, and that we deliberately make sure that our programs have the consequence of reducing the income inequality gap.
I understand this, but I'll go, Karen, go first.
And I was going to say that what the government came up with is these pooled pensions plans. They are not going to serve Canadians. I mean, the fees are going to be high. I mean, there's no guarantee on what the outcome is going to be. So I believe that we should add another facet to the CPP and allow people to contribute, and also because of the flexible, so that it's a sideline kind of program, and because so many women end up in poverty. I mean, we have to look after these women who raise these children, who are the people having the jobs and paying the taxes now. So to have them move off into poverty just isn't acceptable.
Right.
So I just want to raise one. Yeah, I certainly share the CPP is the right thing to be expanded. These pooled registered pension plans, even Mr. Harper should be listening to the C.D. Howe Institute. It's not working, and mostly because it's being done province by province, no comparability, no intersection, and so that's right off. Martha's quite right. People that stay home with their kids and say they should be able to contribute. I've met so many mothers that have stayed home and they want to be able to contribute. That's a no-brainer, and so therefore, yes, move towards the universal side of things. What I wanted raised, because I always raise this, we need the national leadership, but this is a federal-provincial matter, and I don't think it's easy. It's too easy to talk about guaranteed annual income. We do have components. We have guaranteed income supplement. Yes, too low, has to be. Why can't we set it at levels? But we need to get all the governments in the table. And what Mr. Harper did wrong with the OAS increase, I'm not pathologically opposed to it. We're all working longer, some of us. We know that many can't. Is he just announced it from Davos and said we're doing it, and the provinces went, oh my God, we're going to have to, it's going to throw people onto social assistance and so forth. So you don't do it that way. You do it with all the governments at the table and in Parliament. You send it to a committee and you say, go away, come up with pension reform, and come back with a unanimous report. Force all the MPs to work together and come up.
Okay,
well, that's Mr. Harper.
That's his pattern for everything. That's why we
right.
have to defeat the Stephen Harper government.
Okay, we're not partisan here, are we? Okay, so we're going to move on to the next question. We're moving on to the East Coast now. Bill Van Gorder.
Hi, I'm Bill Van Gorder, Chair of the Nova Scotia chapter. What will you and your government do to ensure all Canadians have the same access to affordable drugs no matter where they live in Canada? Drug coverage here in the East is poor, and some people have to choose between paying their drugs or their rent.
So Martha, you lead off on this one.
That one's, it's an easy answer. It's a difficult solution, but I think a number of us have been advocating for quite a few years. We do obviously need a national pharmacare program. I mean, the challenge that gets us into is the funding, is the affordability of it all. And we cannot be so naive as to think that, well, let's do this, let's do this, let's do this, because there is a limit. We do not have unlimited resources in this country. And the price of drugs, as everyone knows, is just skyrocketing, right? It's also the availability, in the sense that there's so many more that are coming available for different illnesses that are now available, they're costly, but as a society we're now consuming, if you will, we're benefiting from so much more, and so all of the costs are going up in that regard. One of your earlier questioners asked about income testing. I think we're all very leery about something like that. There are a whole lot of social issues associated with something like income testing. On the other hand, I do think it's important that we acknowledge that this is far more difficult for some in our society than for others. So I'll leave that, but it's
let's hear some solutions.
But we do need a national pharmacare program.
You have stated the question, absolutely. So what are some of the answers?
If I may, it's interesting what you say. We need a national pharmacare. I guess we're all going to be on the same side. And there was a study table last year, to the best of my recollection, talking exactly about that national pharmacare. It exists actually in New Zealand. And it's been proven, actually, that if we would have national pharmacare here in Canada, we would save some money. Yeah. So why we wouldn't be moving forward? So what I would suggest here is really to have a national consultation and look at best practices elsewhere in the world, because it's more expensive. When I look at my mom, for example, the money that she has to pay for pharmacare every month doesn't make any sense. Looking at the revenue that she has, she basically has no revenue. Having said that, society is changing a lot. We've been speaking earlier about home care, about family care. I mean, the reality are the challenges that we have ahead of us as the Canadian government is changing. And what I believe is that, and of course I'm former Minister of National Revenue, when I look at the Income Tax Act, it's a puzzle actually. It's a patchwork. I believe we need to get involved into a major reform of the tax system in order to be able to focus where there's really need, actually, according to the new demographic.
So I'd like to touch a bit into the pharmacare issue. In British Columbia, at the time that I was at the cabinet table, the costs were going up 14% a year. Sure. I mean, think about what that does to an environment budget when The costs of the health budget were rising at 7%, but pharmaceuticals at 14%. And one of the things that I think is not acceptable is that the agency that vets and approves new drugs is actually half funded by the pharmaceutical industry itself. So that there may be some expensive drugs that are actually not that much better than the ones already on the market. One of the benefits of a harmonized approach to pharmacare is that we wouldn't need for each province to have their own agency that is approving drugs, so you can get a certain drug in one province.
One buyer.
And one buyer.
Yeah,
One buyer.
So
New Zealand, it's exactly that, one buyer.
There's a second thing that I just wanted to quickly say around prevention is that the majority of Canadians are using some kind of complementary and alternative medicine to help with their prevention of chronic diseases and other diseases, and as well healing. But there is no support by the federal government for research to validate which of those therapies are pass double-blind tests and so on. So
That's
I think
part of the rigor of the system.
so that is
Karen.
part of what we should do.
The studies have shown that we would, even just, if all we do is bulk buy our drugs, just that one thing, we would save somewhere between $2 and $3 billion a year. And then you take that $2 and $3 billion and you reinvest it back into the system and do some of that preventative work, do some of that long-term work, because we're not doing that.
Well, in fact, the provinces are bulk buying some generic drugs now.
But 13 is still not nearly as effective as one.
Absolutely,
I know.
Deborah.
I'll just bring it back to the practical thing, which is the federal provincial side of things again. And right now it's being handled by this Council of the Federation with the provinces alone. That has to change. And the gentleman who was asking from Nova Scotia, we all know that Quebec has, there's something going on there. I don't quite understand how it happens, but it raises the cost of pharmaceuticals. You can do it. But it's because of the different provincial arrangements. And I'm sure the gentleman would agree that there's, and I think I read it in your material, are we subsidizing, companies set up along the highway going into Montreal? I'm not just saying there, it can be elsewhere. But it's very inequitable. The role of the federal government is to ensure equity across the country. So we have to have a mechanism and get a mandate. And I believe that that means in the next general election, you have to go to the people and say, as I said before, we want a mandate to have national health care standards, to purchase in bulk, et cetera, so that when you get that mandate, the provincial premiers, including Madame Marois, if she's so lucky to be there, I don't think so, but she will have to come and she'll say, okay, there's a mandate here, we're coming to talk about it.
I think it helps if the federal government comes to the table with money. They're more likely to get the attention of the provincial.
They need to get the mandate. The people speak in elections, and many of you guys do.
But a great deal of the money in the system does come from the federal government, and that's where, again, it is the Canada Health Act. There is absolutely a role for the federal government. We are all taxpayers. We all contribute money to the total, and I believe we absolutely have a role to play at the table to say, and with all of this, there are things in terms of national equity and national opportunities, not just national equity, but national opportunities for some of these
alternatives. Switch to per capita funding for health care, that's really going to harm the provinces that have an older population.
And a smaller population.
And a smaller population. So that was actually a step directly towards inequality.
So it should be about equity of access.
Absolutely.
So that the funding recognizes those things.
Instead of going the opposite
If I can
direction.
just insert here, I have a very specific proposal here, and this goes to Australia and the other countries that have similar, they go after pharmacare and they take care of things somewhat better than we do. There is a mess in terms of fiscal transfers. We don't ensure equity. Our equalization, no one understands how it works, and we should not be moving to per capita when we really are looking at fiscal capacity and what. So it's a commission on fiscal transfers. Australia has it. It's an independent commission of experts. It reports to the national government, makes a proposal for equalization each year. It's nothing that is Ottawa governing or anything. It's experts that are there gathering the information on the tax bases and things that are going on in the provinces and coming to the table.
Okay. Now, just in case you don't think we have CARP members here in Toronto, the next question is going to be questioned by Adina Lebo.
Hi there. Welcome, everybody. My name is Adina Lebo. I'm the chair of the Downtown Toronto CARP chapter. So all the word on tomorrow's federal budget is on increasing jobs and job creation. However, older Canadian workers have not been mentioned. What are you and your government going to do to ensure that older Canadian workers who want to work, and more importantly, those who need to work, can have access to jobs?
Thank you, Adina. Karen.
Okay, Adina, thank you. Perfect question. And it's an issue that we're not the only country that has to address it. I was reading a report about what's happening in the United States. And so they've come up with a program where senior citizens actually go in and work with at-risk kids and go in and work in the community centers and go, and instead of paying them like an income, because then they would lose access to certain benefits and access to housing, they're paid a stipend. And they call it a stipend, and it's enough to raise their income, keep them active, contribute to the community, and recognize the contribution they have to make to the well-being of that community. So there are ways of doing it, and we have so much to offer the community. But right now, the way that the tax rules are actually structured, it actually hurts seniors who want to go back to work and hurts seniors who want to make a difference in their community. So we really need to look at that and change that entire dynamic. It's heading in the wrong direction for sure.
Thank you.
I would say it starts with a decision by the government that that's a priority, and it would be a priority for me. It's not a simple matter. You have to analyze what the barriers are and what the policies are needed to change it. But one piece of experience that I have that directly concerns that is that when I was the Minister of Management Services for British Columbia, I was responsible for the BC Public Service Agency that managed the 28,000 civil servants in British Columbia. And as a minister, I was aware that there would be a lot of civil servants retiring, and there were a lot of barriers to them actually staying part-time or staying on longer because they would be penalized because of the whole pension structure. So I instructed my deputy minister to do an analysis of what are the things in the way of having people be able to work longer. There's just one other piece that's related to this, and that's that we right now under Stephen Harper, we have lifted the cap on temporary foreign workers. The numbers have tripled in the last 10 years, and so there's jobs that I think people would be suited for and qualified for and would like to have, who are in their senior years, that are being taken by people who are here temporarily and essentially heading back to their home country.
Right, Deborah.
So we're sort of heading along this way. Yeah, I mean, I'll just add, we're talking again about the human side of government, the human side of society, and so clearly we want to have as many people productively engaged as we can. The skills side of things is very important, or finding and getting people into jobs. Joyce is quite right. There is a huge mismatch, and the government is acknowledging it, and we should watch out to see what they're doing. But the real problem is there are billions of dollars in training goes to EI, through EI, to the provinces, and most people aren't on EI, but who are unemployed or underemployed or in non-standard employment, and that includes a lot of elderly people. So to the extent you need skills, we have to do a much better job, and it means collaborating with the provinces and making sure that these you can actually pull all the streams together. Another proposal that I have, you could even rethink EI. Take it, say to employers, you don't have to pay the premiums anymore. It's going to come out of general revenues because we want you to create jobs. So we'll take that off you, and we're redefining unemployment. And it doesn't just mean someone that is employed in the current situation.
So incentives, Martha.
And thank you again, Adina, for the question. I will add just a little bit of caution, just simply because everybody is looking for work now, right? And we're hearing, I got to tell you, we're hearing from youth groups, from student groups who are graduating from university and college, and I'm sure a whole lot of your members have children or grandchildren who are facing this. And so it's not just the one age group, it is a much larger question of employment. And you know, and Joyce is absolutely right about the temporary foreign workers, but every report is saying that is happening because the skills aren't matching, the skills that we have, regardless of age, are not matching the jobs that the private sector wants. And you know, but generally, I mean, and let me stress that the government isn't the entity that creates jobs, other than the public service, but it's the private sector, and we want a government that creates an environment where the private sector can thrive and flourish.
What
because
specifically would they have to do?
But this is the piece about, if you have jobs that you know you don't have the skills for, then how do we get those skills? And regardless of age, how do we make sure that those skills are there? And Deb's right. If you talk about apprenticeship or retraining, not so much apprenticeship or retraining, it's focused on EI. You're obviously hitting the wrong people. But let me just add, young people bring a very different level of experience than older people, and that's a big part of it. Some of those skills benefit. But that's what I'm saying. There are some skills that would actually be best filled by people who have a larger life experience than some others. But that all comes to the whole question of fitting the skills.
You know what, I want
with the
to
jobs.
ask Martin Cauchon, as former Justice Minister, what do you do about the kind of discrimination we see in the workplace against older workers?
I mean, for example, I was reading on your website the question of the people that are arrested by police forces because of their age while driving. That's an interesting point because to me it's a question really discrimination based on age. And as former Minister of Justice, I just cannot accept that. I believe actually if you have to stop driving, you should stop driving because you don't have the capacity. And that will take place between you, your family, and your doctor as well. So when you focus on age, when you stop people because they look 65, 70, that has no place in my society. And as Minister of Justice, I just cannot accept that. Having said that, when you look at the question of the workplace, actually, society is changing. People, they live longer and they live healthier. I mean, I'm going to tell you, a lot of people around me are very, very good friends of mine. They're 65, they're 70, and they're top shape. And they work full time. On the campaign trail, though, what I saw, it's people losing their job at 55, 60. Those people are facing a huge headache because most of the time they still have family, and corporations don't want to give them a job because they don't want to invest in those people.
Yeah, but let's
Okay.
be
It's a huge,
honest.
There's
We have
lots
had
more to
major
talk about.
discrimination in the
Yeah,
workplace for
absolutely
women,
true.
for people of color. This country has made great strides.
Okay, you're
We have, but
anticipating
we
my next
clearly
question.
have to move further, but we should benefit from all that we have learned and all of the progress we've made in terms of women and
Okay.
visible minorities
You are
and move
anticipating.
that to older people. in
You're
this country.
anticipating my next question. That ends the formal round. I've got one more question. Relax. This is important. Now, 6 of Canada's...
This is important.
They're all important to us.
Okay, 6 of Canada's premiers are women, governing 88% of the Canadian population, with apologies. What difference will that make? What difference should it make? Do we have some misplaced expectations?
Oh, goodness.
I think it is a fantastic trend, but really we have to show leadership because otherwise in Parliament it will take, I don't know, 100 years for us to get to parity at the rate we're going. And so really that's why I launched my campaign in November saying that I would appoint a minimum of 40% women and a minimum of 40% guys, of course,
Okay, so we'll make it fast.
on any federal board as well as to cabinet. And then,
Right.
yeah.
Deborah.
Well, I share with what Joyce is saying. It's great that we have so many premiers that are women, but we need to make sure that we have many more elected representatives, many more directors on corporations that are women, and sort of have it. I think we have to get to a critical minimum, and we're not there yet. So we probably need some government legislation, like on the boards of directors side of things, to help move
Karen,
along.
you were in the armed forces.
Yes, and I have some experience on how to get women involved and how to make them safe and comfortable in politics.
But will it make a difference?
It will, because what we did was we never sent women to a squadron by themselves. They never went on their own because then you're more vulnerable and you feel alone. So if there's a group of us going, that's better, and we can reinforce each other.
Susan, I just have to laugh because when you said, have we raised false expectations, we never, strangely enough, asked if we'd raised false expectations when the majority of elected people were men.
Okay, Martin, defend your gender.
No, but to be fair,
No, you know what?
Your gender.
We're both going to be almost on the same side. I can tell you
Right, but
something.
every study has shown that once you get past a third, Catalyst, the organization who does this for corporate boards and in the private sector, has shown this. Equal Voice has shown this. Once you get past a third, all of a sudden you actually do change expectations. You change a barrier, and I think we've
tipping
reached
point
one
is going
in
to be
some
when I
ways.
get the cameras cut off.
Government is a unique place to change society, actually. And I believe that we need people from all walks of life. And if you're facing challenges in your society, get involved. Get involved as a member, and then after you become minister, and that's the only way really to change, one of the ways to change your society. I remember when I was justice minister, and I was facing a question of same-sex marriage that we all know. There was a question of equality. It was a tough decision to make. I stood for equality. Today we have same-sex marriage, and I'm very proud of that. I changed society, I believe.
I think
so
you did.
more women we're going to have, better it's
to
going to be.
I'm going to change your lives today because You are running for the Liberal leadership, but something else that you've gained from coming here today, you will become honorary CARP members. So I thank you for taking the time to be with us and give such thoughtful answers. And I thank you again, and we'll see you on the campaign trail. Thank you very much.
Thank you. My pleasure.
Thank you,
Libby.
Susan. That's wonderful.
Okay, thank you very much, Susan. This has been the 2013 CARP Leadership Forum. Thanks to the participating candidates, Martin Cauchon, Deborah Coyne, Martha Hall-Findlay, Karen McCrimmon, and Joyce Murray. We would also like to thank our studio audience and all of the CARP members watching the debate online across the country. Now, this program will be broadcast nationally on Vision TV on April the 1st at 9 p.m. Thanks for watching. I'm Libby Znaimer.